Assalamu alaikum. So now the video station for high steppage gait. So first of all, a description what is high steppage gait. So high steppage gait is that here the first knee high high up and then toes touch the floor followed by the heel. Normally, what happened? First of all, heel touch the floor, followed by the toes. But in case of neuropathic or high steppage gait, first knee higher and then toes touch the floor, followed by the heel. So we can see the video. So yes, so knee higher and then toes touch the floor, followed by heel. Followed by heel. Okay. So, what could be the causes? So, what is the difference between the toe walking and this high steppage gait? In case of toe walking, just the toe touches the floor, not the heel. But in case of this type of high steppage gait, toe first touch the floor, followed by heel will touch the floor. And now the description that in the video I can see that a uh, 14 years old male child, he shows to he looks like well grown. No, there is no device in hospital setting, and gait examination reveals that there is right sided, there is high steppage gait with foot drop here, the knees high up, then toes touch the floor, followed by the heel. So what could be the causes of unilateral high steppage gait? And the causes could be the poliomyelitis, and there could be spinal cord tumor, peroneal nerve injury, and the trauma of the fibula fracture. And if it is bilateral high steppage gait, what could be the cause? Cause could be the Guillain-Barré syndrome, Charcot-Marie-Tooth disease, causes of peripheral neuropathy followed by vitamin B12 deficiency, diabetes mellitus, thyroid problem. Medication can cause it, such as the vincristine, Lyme disease, and lead toxicity. So, what could be the history for this? History could be the onset course and duration of this. Is there any preceding illness present or not? And if it is a GBS, so is or constitutional symptoms, weight, fever, activity. Is there any breathing problem present? Any problem with the deglutition? Any palpitation? Any urinary retention? Any history of the trauma, any history of taking the medication, especially the vincristine, any chronic illness such as the diabetes mellitus, thyroid problem, the vaccination history, and the travel history. So what could be the examination findings if it's a case of Guillain-Barré syndrome? So if it's a case of Guillain-Barré syndrome, the examination findings, examination of the airway, breathing, circulation, vital sign, emphasis on the pulse and blood pressure monitoring, full neurological examination with the cranial nerve examination, especially ptosis and severe nerve palsy for the Miller fissure, and respiratory system examination and cardiovascular system examination and para-abdomen examination for retention of the urine. And what could be the investigation? It's a clinical diagnosis and supported at the immunocytological dissociation from the lumbar puncture. We get the information, MRI of the brain and the spine with contrast, is there any lesion present or not, and nerve conduction velocity will be decreased, and bedside peak expiratory flow rate and vital capacity, or we can do ask the child to count 1 to 10 in one breath, and a baseline ECG, as there's a chance of arrhythmia, and blood pressure monitoring. And what could be the management? Management is acute management and chronic management. Acute management, I will involve my consultant and a neurologist, respiratory physician, cardiologist, and dietitian. Here, treatment option is IVIG, and long-term management, physiotherapy, occupational therapy, speech and language therapy. And what could be the cause of death? Respiratory failure and arrhythmia. And what would be the prognosis? Prognosis, if there is intubation or cranial nerve involvement, so the prognosis is worse. And the main indicator is the time to initial the improvement after maximum weakness. And worse prognosis, those who not recover more than 2 weeks after the start of treatment. And this all about the high steppage gait. Thank you. Assalamu alaikum.